Okay, Dr. Ravich here from Vet Triage. We're continuing through this issue of JAVMA from January 15, 2015, Animal Behavior Case of the Month. This case comes out of a clinic in Ontario, Canada. A cat was evaluated because of aggression toward the owner on multiple occasions. 4.5-year-old male Maine Coon. They were found as a stray. He was aggressive behavior. The cat would seek attention from the male, but not the female owner. It avoided the female owner, but tolerated petting. Over time, the cat started stalking the female owner in the house, especially in the living room or kitchen. 4 months after adoption, the female owner started taking the cat outside on a leash and a body harness. The female owner picked the patient up with the intention of taking it into the house. It attacked and bit her hand. The cat bit the male owner later on when picked up from the couch. The owners noticed that the patient had signs of aggression when it was surprised by the female owner, when it watched other cats outside, when it was handled, like during nail trimming or brushing or petting. Physical exam was normal. CBC, biochemistry panel, thyroid, and urinalysis all normal. Diagnosis was fear and anxiety-related behaviors exhibited by flattened ears, low tail carriage, dilated pupils. It had redirected fear aggression towards both owners after watching outdoor cats. Part of the cat's aggression was determined to be results of inappropriate play with the male owner and petting intolerance. Other possible reasons for the cat's aggression included territorial aggression and medical conditions like pain and neurologic or metabolic disease, but these were all ruled out. Territorial aggression was also ruled out based on the history, the observation that the cat had aggression only when confronted or manipulated by the owners, and the fact that the attacks were arbitrary locations. A diagnosis of status-related aggression, although uncommon and controversial, was also considered, but the history indicated that the cat allowed the owners to take resources away like food, toys, attention, sleeping pillows, and removed it from various locations while having signs of possessiveness or aggression. So the treatment, because the owners were about to have a child in 4 months and the owner's main concern was child safety, the objective was to keep stimulation of the cat lower than its aggression threshold until the subsequent behavioral consultation, at which time desensitization and counter conditioning might be introduced. The recommendations were to prevent situations known to lead to aggression, like handling and rough play and picking the cat up, establishing a confinement area, providing for the patient's needs when it was confined, like litter box, food and water, environmental enrichment, like food, like feeding toys, towers, and perching places, blocking access of outdoor cats to the yard or block the patient's view of the cats outside, avoiding punishment, and establishing a daily routine that included confinement, supervised time outside the confined area, and interactions with the owners. Moreover, the owners were instructed to place a feline appeasing pheromone diffuser in the confinement area and to administer fluoxetine, which is Prozac, the appeasing pheromone diffuser, and fluoxetine, which is a selective serotonin reuptake inhibitor, were selected to reduce the cat's fear and anxiety. Over the next several weeks, the owners reported the cat was doing pretty well overall. The recommendations were to continue with confinement of the cat when it was unsupervised, use a body harness on a leash when the cat was outside of its room as a safety measure, reward the cat for all successful interactions with the owners, and schedule controlled petting and playtime only when the cat was likely to be calm. In addition, the owners were advised not to feed the patient prior to interactions to increase its motivation to take food. They were instructed to handle, meaning holding, petting, and playing the cat for short periods of time at first. After successful handling of the cat, they were to slowly prolong such interactions. They eventually increased the dose of fluoxetine, and they increased it because the cat tolerated the previous dosage and wanted further reduction of anxiety. Then the baby and the cat were in the same room. The owners were to give the cat positive reinforcement and never let the cat and the baby be in the same area alone. In addition, the owners were to gradually increase the time the cat and the baby were in the same room and to decrease distance between them. 3 months later, the male owner reported the cat was doing well. The dosage of fluoxetine was reduced. 3 weeks after that, the female owner reported the cat's anxiety seems to have increased and that it started stalking her more, so they increased the drug. In addition, the owners continued to use their pheromone diffuser in the cat's room because they thought it was more anxious than when the diffuser was empty. So that's it for that report. I mean, so for veterinarians, obviously behavior issues are difficult, especially in cats, because they're so finicky and it's so hard to decipher what's triggering them in terms of the bad behaviors. And it's very easy for veterinarians to just say, kind of get a new cat, because there are other cats that would be fine in this environment with a new baby born and all that stuff. And this cat might be able to be lucky enough to find a household where there's no new baby and all that stuff. But it's tough with veterinarians. So just some ideas for using the diffuser and for behavior modification through the environment, as well as interactions with the pet owner. And then, of course, fluoxetine. And then for pet owners, you have to understand too that cats are really hard to train. A lot of times this type of interaction has to be gradual with cats. You have to acclimate them over time, whether it be to humans or to other pets. So be patient if you're going to try and fix a behavior problem with cats, and see if that introducing a cat to a new household is going to work, because a lot of times these measures don't work and you end up having to relinquish the cat because of the difficulty with behavior modification. So, all right, we'll see you guys in the next one. Take care.